Thank you to the organizer for this kind invitation and for this opportunity to present you the data of this study that we performed on our cohort of patients with the DADA2. So, an upregulation of type 1 interferon gene, so-called interferon score, has been described in the last years, not only in patients affected by I.R.C.S syndrome, but also in other rheumatic conditions, including DADA2 patients. And so the aim of this study is to describe the clinical course of our cohort of patients and to assess the role of interferon signature as marker of disease activity and severity. And this is a table that sums up the clinical and laboratory features of our patients, their mutations, and the response to TNF inhibition that was complete in all the patients. And if we look at the clinical features, we can affirm that our patients confirm the phenotypic variability of this condition. We observed indeed a wide range of severity, from a limited cutaneous vasculitis in patients number 5, and she presented the first symptoms at the age of 10, to a multisystemic involvement picture in the patient number 4, who presented since he was 1 year with neurological involvement, with a persistent inflammatory state, with a malignant hypertension. And I would like to underline that malignant hypertension in these patients was due to multiple kidney infarction. So based on this fact, in the observation of a malignant hypertension in patients with DADA2 patients must due to investigate the kidneys. And patient 3 and patient 4 are 2 brothers. And further confirming the phenotypic variability of this condition, the younger brother, albeit carrying the same identical mutation, showed a much milder phenotype characterized by the 1 single episode of prolonged fever and some abdominal pain and some arthralgia. And however, this younger brother is the only one patient of our cohort who showed a mild IgM hypogamma globulinemia. So in overall, we identify in this cohort of patients 6 mutations. 2 of these mutations, the last 2, were described in other patients, while the other 4 mutations are a novel frame shift variant and 3 novel missense mutations that are predicted to be pathogenic by 2 in silico softwares out of 3, never described in other patients. And type 1 interferon score was defined as plasma levels of 6 interferon-related genes and was calculated as known. And we calculated also interferon score and considered positive an interferon and a score higher than 1.42. And we measured the interferon score not only in these 5 DADA2 patients, but also in other conditions, in 7 patients with I.R.C.S, in 26 juvenile dermatomyositis, in 27 lupus, and in other rheumatic conditions, such as you can see here, juvenile idiopathic arthritis, chronic non-bacterial osteomyelitis, and familial Mediterranean fever. And we found that interferon score, as expected in IGS and in lupus, resulted higher compared with DADA2 patients. Values of this score resulted comparable in juvenile dermatomyositis and DADA2 patients, while in the other condition, the score resulted negative. So 4 out of 5 DADA2 patients had the interferon score positive. And the only one with the interferon negative was the younger brother, which one with the single episode of febrile prolonged. And all the patients were treated with the etanercept with a prompt, complete response. And after treatment, we observed a markedly decrease of interferon score, that score normalized in 2 out of 4 patients. So the mechanism that lead to the activation of type 1 interferonopathy in DADA2 has not been clarified, but I think that some lights will provide during this conference. And we correlated the type 1 interferon score of each patient with levels of CRP at disease onset and after treatment, finding a significant correlation. And in order to confirm the activation of type 1 interferonopathy, we measured also the levels, the plasma levels of two chemokines, 6CL9 and 6CL10, that are induced by type 2 interferon gamma. And we found that the levels of this chemokine in DADA patients were comparable with healthy donors, confirming that type 2 interferon pathway is not activated in this condition. So, in conclusion, our data confirm the high variability of DADA2 regarding age of onset, severity, and organ involvement, even within the same family and even among patients with the same mutation. This implies a role for other genetic or epigenetic modifiers or some environmental factors on the disease expressivity. And furthermore, this data suggests that interferon score may represent a biomarker of disease activity, severity, and response to treatment in DADA2 patients. And thank you for your attention.